Okay, so nutrient canals. What are the nutrient canals? These and the septa and bony nodules. These are three things that we can see in the maxillary sinus. So first of all, the nutrient canals. Okay, or now we talk about a tooth. So how does the tooth get the nutrition? Through some blood vessels, right? So these are called the nutrient vessels, right? Now these nutrient vessels, the canals which carry them towards the root apex. So where does it all enter? From the apex of the root, right? So at the apex of the root, there are blood vessels which come to the apex through canals, right? So these nutrient canals are thin radiolucent lines of uniform width within the lateral sinus wall, and they accommodate the posterior superior alveolar nerve and the superior alveolar nerve. Okay, so let's see if you can see here. Okay, it's not very clear over here. Just a second. Nutrient canals. 1 second. Yeah, they are very clear when you see the in the lower anterior. Can you see this? 1 second. Yeah. Can you see these? See, you have these lines which converge towards the apex. Okay, so same thing. I'm showing this clearly in the mandibular IOPA, but the same thing is in the maxillary. Okay, you have these radiolucent lines which जो apex के पास they come and they get into the apex, right? So these are the nutrient canals which are more evident in the mandibular region. So we have nutrient canals. Then the next thing is the septa. What is the septa? These are the folds of cortical bones that are projecting away from the floor and the wall of the antrum, usually vertically oriented. A complete septa did in fact divide the sinus into individual components in 1 to 10% cases. So the septa are the scalloping. Can you see this? See, the sinus is not plain like this, not like a balloon shape. There is some scalloping and it's a 3D structure. So there are scallops everywhere, right? So these scallops, when we see it in a 2D structure, they are known as the septa, which are the folds of the cortical bone. Okay, so just remember that we are talking about the folds of the trabecular bone, of the cortical bone, right? Okay, now the third thing which we can find in the sinuses, the bony nodules, it's the normal variant of the floor of the maxillary sinus, homogeneous, radiopaque with trabeculation, and it blends with the adjacent bone. If you look at this clearly, okay, these are variants of the maxillary sinus and they're radio opaque because it's a nodule of made of bone, so it is opaque and it blends with the adjacent bone. Okay, so now your zygomatic process and the zygomatic bone. Okay, so we have two things over here: zygomatic process of the maxilla and zygomatic bone. These are two things which come and meet over here. Okay, so this is the zygomatic process of the maxilla, which is a part of the maxilla, and the second is the zygomatic bone. Okay. Okay, now we're talking about the zygomatic process of the maxilla. Extension of the lateral maxillary surface arises in the apical region of the first and the second molar, and it's the articulation for the zygomatic bone. Now, how does this appear? It appears U-shaped radiopaque line on periapical radiographs. Right? Inferior part of the zygomatic bone extends posteriorly from the inferior border of the zygomatic process of maxilla, a uniform gray or white radio opacity over the apices of the molars. Okay, what have you understood from here? See, just keep two things in mind. This whole thing is made up of two parts. One is from the maxilla, one is from the zygomatic bone, right? So now when we're taking an X-ray of the molar, I'll just draw it here and show it to you. Okay, yeah, okay. See, when I, can you see this round thing over here? This is the U-shaped structure is the zygomatic process of the maxilla. Okay, and the continuation of this posteriorly is the zygomatic process. Sorry, it is a zygomatic bone. Okay, so we have two things here. This, I'll just write it as process, that is the zygomatic process of the maxilla. Okay, not able to write. Okay, this is the zygomatic process. Okay, and this is the zygomatic bone. Done. U shape is a zygomatic process. This extension is the zygomatic bone. The U shape you will see above your first or your second molar, and the zygomatic bone will be the second and third molar posteriorly, like this. Done? Okay, let me just erase this. Okay, done. Yeah. Go to the next slide. Okay, put that as the mouse. Okay, next slide. Yeah. Now the nasolabial fold. This is important. Why? This is your nasolabial fold. Okay, the lip and the nose, the fold of which is here. It is an oblique line on the periapical radiographs of the premolar region, and the area of increased radiopacity is posterior to the line. Okay, my photo is overlapping this. I'll just shift this from here. Yeah, okay. Better. Can you see this? Okay, so this is this line. Okay, so this line is like this. Okay, so when I take a radiograph, this line that is seen is the nasolabial fold. Okay, and the more opacity is seen posterior to the line, and anterior it is lighter in color, right? That is more radiolucent. So this is the nasolabial fold, and this is mostly seen at the level of your premolars. You have to remember, where is the Y line of NS? Canine. Where is the nasolabial fold? Premolars. Where is the zygomatic process of the maxilla? On the molars. Where is the zygomatic bone? On the second and third molars. Clear? See, you should know these by heart, because that is only when you know what you're going to find on a radiograph can you correlate. Like if I see this radiograph and I don't know what I'm talking about, I can just see that there is a line and it's very clear. Can you see? It's a very clear dark line demarcation. Okay, oblique, and it's not wavy also, it's a clear oblique line. So it is a nasolabial fold. If I know I'm going to find a nasolabial fold on my premolar region, so the minute I see an oblique line on the premolar, it's going to click me that this is the nasolabial fold, right? So that's how you're supposed to learn. There is no mugging up you can do here. You have to learn and you have to remember, right? Understand first, learn, and then remember. Okay. Now we're coming to the pterygoid plates. Yes, okay. So first of all, before we start reading this, what is the pterygoid plate? Does anyone know? Okay, this is at the back of your maxilla. If you can see over here, these processes, that is the medial and the lateral pterygoid plates, are seen. That is posterior to your tuberosity region, right? So the medial and lateral pterygoid plates lie immediately posterior to the tuberosity, and they almost always cast a single radio-opaque homogeneous shadow without the evidence of trabeculae if apparent on the intraoral film. The hamular process extends downwards from the medial pterygoid plate. Okay. So now, see, these pterygoid plates, finding the pterygoid plates on an IOPA is very difficult because they are situated very, very posterior to your third molar. Can you see third molar over here? Okay, so to get a pterygoid plates and the Hamler process over here, I will have to take the film very posteriorly and then also angle it in a way that it projects on it. Okay, so there are two lines over here, that is the radio opaque shadows of the pterygoid plates. These are not commonly seen on an IOP, only few, but you should know. See, can you see this outline over here, that extending beyond the tuberosity, exactly where the tuberosity ends? After that, you have this plate. I will draw it. Just give me a second. Okay, see, this is your third molar. Please excuse me. I don't have my mouse, so my drawing is not so perfect over here. One second. Yeah. Okay. So this is your third molar. And this is your tuberosity region. Okay. Now after this, you will have a bone which is pointing backwards like this. Okay. So they're two together. So medial and lateral plates. And this you will see on a radiograph when you take an IOPA position like this. Okay. Very posteriorly. And how do you differentiate that? It is solid and it has a single radio opaque homogeneous shadow without evidence of trabeculation. Okay, what does this mean? See, if you see the if you see your tuberosity region, can you see this trabeculae, the holes between the bones, the radiolucency? Now, when you see the pterygoid plates, they do not have trabeculae. Okay, they are homogeneous, they are opaque, they're completely opaque structures. Done? Okay. Okay, hope you are clear with all this. Let's go to the next slide. Okay, so we are done with the maxilla. Okay. Now we're coming to our mandible. Let us just quickly go through what all we saw in our maxilla so that we don't forget. Intermaxillary suture, anterior nasal spine, nasal fossa, incisor foramen, superior foramen of the nasopalatine canal, then the lateral fossa, the nasolacrimal canal, maxillary sinus, zygomatic process, zygomatic bone, the nasolabial fold, and the pterygoid plates. Done? Okay, great. Now, all of you must be patiently waiting for the mandible to start. Most of the students like the mandible, right? It's easier to find the anatomy there. That's what I think. I don't know. Okay. So we have started now with the mandible. We'll go through all these terms first. The symphysis, genial tubercles, mental ridge, mental fossa, mental foramen, mandibular canal, nutrient canal, mylohyoid ridge, submandibular gland fossa, external oblique ridge, inferior border of the mandible, and the coronoid process. Okay. Do you people know all these terms? All this has been taught in your anatomy, right? First year BDS. Okay. We have drawn the mandible in anatomy. Do you remember? Okay, let's just draw it now. Here. Okay. Wait, I will try sharing a whiteboard over here. Yeah, okay. I hope you can see my whiteboard. So let's just draw a mandible over here. Okay, so this is the coronoid process and this is the condyle. Okay, this is the coronoid. Then when you come down, this is the anterior border of the ramus, right? Okay. Then when you come here, you have your molar. Okay, I'll make this is the third molar. Then you have some foramina starting here. You have a canal which comes till here. Okay, so this is the third molar. Then you have your second, you have your first, then you have your premolar over here. Okay, so this is your premolar. Okay, and this is the opening. Okay, this much we remember, like this. Okay, so now for a mandible, let us just see once. Okay, and make incisors also. This is your incisor in the anterior. Yeah, so this is your incisor, central, lateral, or all are between. I'm not drawing them. Okay. Okay. Right. So now we can take a radiograph of your central incisors, this area. We can take of your laterals and your canine. We can take premolar, we can take molars, and we can take third molar, right? That is how it goes. Okay. And you know the positioning for everything, the angulation, vertical, horizontal. Okay. So now when we are getting all the angulations right, we will see these all landmarks very clearly in the mandible. Why? Because the mandible is more denser than the maxilla. So that is why we have less of trabeculae and we can, it's more of cortical bone and we can see it very clearly. Okay. Okay, I'll just stop sharing and I will share my screen again. Yes. Okay, where are we now? Just give me a second. Yeah, perfect. Yeah. So after I have shown you the diagram, let us proceed. First of all, the symphysis. What is the symphysis? We had intermaxillary suture over here. The same thing over here because there are two parts joining in the middle. So it is a symphysis. It is a radiolucent line in the infants when the in the newly born or below 1 year of age. The radiolucent line is seen throughout the midline of the jaw. The suture usually fuses by the end of the first year of life. Then it is no longer radiographically apparent. Okay. So the intermaxillary suture, it is a very, when you see it in adults, it is usually not apparent or you will see a very faint line, but it is very clearly seen if you can see over here in a newborn where the two mandible haven't yet fused and there's cartilage in between, right? Now the next. Yeah. Okay. The next is the genial tubercle or the mental spine. Okay. Now see, put your tongue down. Okay. Do you feel some elevations over there? Okay. Some bony elevations? That is what we're talking about. Genial tubercle or the mental spine. It is a spine-shaped bony protuberance in the midline, the lingual surface of the mandible above the inferior border. It is well visualized on a standard mandibular occlusal film as one or more projections as a radiopaque mass 3 to 4 mm diameter in the midline below the incisor roots. Okay. Now the lingual foramen, it is a small radiolucent dot surrounded by a cortical wall of the termination of the incisive branch of the mandibular canal. Okay. See, now after reading all this, let's just explain it. Let's just try drawing it once. Okay. See. 1 second. Just give me a second. Yeah. So basically, there is a lingual foramen, okay, that is between your two central incisors, okay, and surrounding that there is the genial tubercles, okay. So we have genial tubercles surrounding that, and they appear as if it is a ring around it, okay. So that is why when we finally draw it, it looks like this and a ring, okay. Okay, all right. So these things again, where are we going to see it? We're going to see it in the mandibular incisor radiograph of the mandibular anterior teeth. But to see this most clearly, where are we going to see it? We're going to see it in the mandibular occlusal radiograph. Okay. Okay. Now we're coming to the mental ridge. Okay. Mental ridge, first look at this diagram over here. Whenever we take a radiograph of this region, when we see two oblique lines, very clear oblique lines like this, okay, that is apex is towards the central incisor and it's sloping down towards the back. So that is the mental ridge, okay. See, put a tongue down, try to feel the, is there some line? Can you feel it from anterior to posterior? That is the mental ridge. It is a radiopaque line sweeping bilaterally forward and upward towards the midline on the periapical film of mandibular central incisors. Okay, so they are radiopaque lines which sweeps bilaterally forward and upward towards the midline on periapical films. Now, what is the mental fossa? It is a depression on the anterior surface of the mandible between the alveolar ridge and the mental ridge. Okay. So, what is the alveolar ridge over here? This, where the teeth are, that is the alveolar ridge. Okay, in the mandible, you have this inferior part of the mandible. You have an alveolar ridge where the teeth are, and in between you have the mental ridge. Okay, so the fossa, see, just put your tongue exactly below the crown of your teeth. Do you see a scooped out appearance? That is the mental fossa. The fossa, that is the depression, and obviously again we'll come to that the ridge is an extra formation of bone, so the ridge will be whiter, right? It is radiopaque. Now the fossa is less of bone, so more of X-ray is passing. So how is going to appear? It's going to appear as radiolucent. Okay. So, and it is a radiolucent depression on anterior surface of the mandible between the alveolar ridge and the mental ridge. Done? Okay. Yeah. Now we come to a very major topic over here, very major landmark. It is what? It is the mental foramen. Okay. Now, why this is so important is, you all know what is a radicular cyst? You know, periapical cyst? Yes. What is it? Okay, it is a cyst due to decay of the teeth, the pulp is necrosed, and the infection is out, right? See, look over here. Can you see? Okay, see a radicular cyst here, radicular cyst. See, look over here, it's a radicular cyst, no? Periapical cyst. Abscess. Does it look like an abscess to you? See, teeth related hair, so radiolucency surrounding the teeth, so it's supposed to be an abscess. That is what you're going to think. If you have not read our landmarks properly, you're going to just say that this is an abscess or a cyst in relation to your second premolar. Done? No. See. Look at this mandible here. Excuse me. This is your first molar. This is your second premolar. This is your first premolar. Okay. Between your first and second premolar roots over here, where your mandibular canal ends, when I drawn the diagram. Okay, so there is an opening over here, which is called the mental foramen. Right now, the mental foramen. Let us just read this once. Keep looking at this diagram, so you will know. Wait, no, wait. You look at this diagram and correlate. This we will come to later. Yeah, this one. The anterior limit of the inferior alveolar canal on the radiographs. It is round, oblong, slit-like, or very irregular, and partially or completely corticated. Okay, it is partially or completely corticated. Corticated means, see, it's a foramen. So foramen is what? Again, close your eyes and you tell me foramen is an empty space. It's a hollow space, and to let out the nerves, right, and the blood vessels. Now surrounding that there will be bone, so that bone will look extra wide or corticated, right, between the lower border of the mandible and the alveolar crest, usually in the apex of the second premolar. Okay, they say it's at the second premolar, but it can range between your first and second premolar anywhere. Okay, so that is a mental foramen. So that is why we need to know, if you have a tooth that looks okay, that where there is no pulpal necrosis or any cavity. See, this is a very nicely restored tooth. So how can it have an abscess or a cyst here, right? And so now, having known what is a mental foramen and where is it, now I'm going to tell you something very important. How are we going to differentiate a mental foramen from a periapical cyst or a radicular cyst or any other cyst for that matter? Okay. First of all, what was written? The location. Okay, first confirm the location. If it's below the second premolar, definitely it's a mental foramen. Okay, if it's for between first and second premolar, it might be a mental foramen. Okay, next, that is the first step. Find the location. Okay, then after that we are going to just give me a second. Okay, so we're done with the mental foramen. Okay, now again a very important structure, mandibular canal. Okay, again it is very easy to locate the mandibular canal. Trace it on your finger or on your face. See, this is your coronoid, this is your condyle. Okay, this is your ramus. Okay, in the center it will start like this. It will run below your molars, premolars, and end at the mental foramen. So when we take a radiograph from between your premolars and your molar region, you will see a radiolucent line over here below the root apices. Okay, so that is the mandibular canal. It is a dark linear shadow with thin radiopaque superior and inferior borders cast by the lamella of the bone that bounds the canal. What does this mean? It is a linear shadow. It is a line. It is a shadow in the form of a line. That is a radiolucency that is surrounded by a radiopaque bone. That is the canal. Okay, it is apparent between the mandibular foramen and the mental foramen and make close contact with all the molars and second premolars. From the mandibular foramen to the mental foramen, and it has contact with all the molars and till the second premolar. Done? Easy? Okay. Now the nutrient canals I showed you in the maxilla. Okay. Now in the mandible, they are radiolucent lines of fairly uniform width. Okay, with hyperostotic borders. What is hyperostotic borders? That is the calcified borders. Okay, hyperosteum. Osteum is bone, so anything with more of bone is a hyperostotic, and it's a border. Now it runs vertically from the inferior alveolar canal to the apex of the tooth or into the interdental space between the mandibular incisors. Okay, they run vertically from the inferior alveolar canal to the apex of the tooth or into the interdental space between mandibular incisors. But या तो tooth के apex पे जाएंगे या फिर interdental space पे जाएंगे. Okay, it is visible in 5% of the patients, especially in the blacks, in the male, in older people, and people with high blood pressure or advanced periodontal disease. Okay. न्यूट्रॉन कैनाल्स 5% लोगों में दिखते हैं, या तो ब्लैक्स में ज्यादा दिखेंगे, मेल्स में मोर कॉमन होंगे, जो ओल्ड एज होगा वहां पे मोर क्लियर होंगे, या फिर एनीवन विद हाई बीपी और एनी पेरिडोंटल डिजीज में क्लियर न्यूट्रॉन कैनाल्स दिखेंगे. ओके ओके, now we'll go next to the, one second, mylohyoid ridge. Okay, we have this rep submandibular gland fossa. Just see how much is left now. Okay, just a second. Yes, okay. So the mylohyoid ridge. Okay, this is the internal oblique ridge. For this, I want you to take your tongue to the below your last molar. See, below your last molar. Do you feel an elevation over there? See, try. Yes. So that is your mylohyoid ridge. It's just the internal oblique ridge. Okay, internal oblique. We have an external oblique and an internal oblique ridge. So it is a bony crest on the lingual surface of the mandibular body, which is the attachment for the mylohyoid muscle. It runs downward and forward from the area of the third molar to the premolar at the level of the apices. Okay, so it starts from the alveolar crest at the level of the third molar. Okay, and from there it will run forward and downward. So forward and downward. Okay, two line terms you have to remember. It runs forward and downward. Okay, till the premolars. Okay, now the submandibular gland fossa. Okay, now this internal oblique ridge which we felt right now. Okay, below that there is a fossa. Okay, so when we palpate the submandibular gland, where is the submandibular gland located? Submandibular gland fossa. Simple. Yes. So what are we palpating towards the bone? We are palpating okay. Yes. So the submandibular gland fossa is over here, okay, below the internal oblique ridge. Now again, the point, why is it a fossa? So it is a depression. So less of bone means more X-rays are passing through it compared to the surrounding. So it is radiolucent. So just remember again a fossa. So it's obviously going to be a radiolucent area. Right, it accommodates the submandibular gland, and it's a radiolucent area with sparse trabeculae, poorly defined anteriorly and posteriorly. Okay, so it is just an ovoid or an oval radiolucency over here. Okay, now again, why this is important is that when we see a tooth like this, okay, so when we see this over here, we see a radiolucency. Now what happens over here is that we confuse this as an abscess. Okay, so most of the new people will confuse this as an abscess. We don't know your anatomy. So for abscess, whenever you're confused for a radiolucency surrounding a tooth apex, always check for the lamina dura of your tooth. If the lamina dura of the tooth is intact, that means that radiolucency is of non-dental origin. Okay, that is, it has got no relation whatsoever with the tooth. Okay, only if you are not able, if you trace the lamina dura and you don't see a continuity, only then it can be an abscess. But when we are talking about the submandibular gland fossa, usually, I'm saying usually because there could also be an abscess related over there and then the fossa. So usually the tooth will be normal. If it is, and the gland, the radiolucency, then that is the submandibular gland fossa. And the region is very important. It is below your molars. So mostly below your third molar till your second and your first molar. It will not usually extend above, beyond your first molar. Okay. Okay, let me go to the next slide. I think this is stuck. Yeah. Okay. So now we talked about the external oblique ridge. So now we'll be talking about we talked about the internal, that is inside the internal oblique ridge. Now we're talking about the external oblique ridge. So this is found external to the mandible. बाहर की तरफ है ये. Okay. It is a continuation of the anterior border of the ramus. It is the line of attachment of the buccinator muscle. Okay. Let me just draw this once. Okay. And just draw it here. Yeah. Okay. See, when I am drawing my mandible, I will draw the condyle, the coronoid and the condyle. Okay. And this will go like this. And then I will draw my. Okay. So this external line. Okay. This is the external oblique ridge. Okay. That is outside. So it is a continuation of the anterior border of the ramus. Where is the ramus? This is the anterior border of the ramus. Its continuation is the external oblique ridge. Clear? Okay. Now, what is the importance? The external oblique ridge is the line of attachment of your buccinator muscle. So your buccinator muscle comes and attaches on your external oblique ridge. It is a radio-opaque line near the alveolar crest and the mandibular third molar region. Okay. So this is done. Now the inferior border of the mandible, it is very easy. What is it? It is the lowest part of your mandible. It is a dense, broad and radio-opaque band. See, look over here. It is a broad radio-opaque band. Okay, that is the inferior border. So how will you get to know that it is the inferior border of the mandible? Because after that, you will see clear dark space. Okay, that is full radiolucency because there is no structure obstructing the X-rays here. So it is full radio lucency over here, black, full black. That is the inferior border of the mandible. Now, yeah. Okay. Now we're coming to the coronoid process. So where was the coronoid process? I just drew it for you right now. Anterior border of the mandible will be coronoid and then condyle. Condyle is near your ear. The front part is the coronoid. Okay. So we are talking about your mandibular landmarks. But I am pointing. See where I am pointing for my coronoid. Okay. Where is my mandible? Okay. Can I get this coronoid process on my mandible X-ray? Any X-ray? See, molar is here, premolar is here, everything is here. Can any X-ray of my mandibular, molar, or premolar or incisor cover the coronoid? No. So where are we going to see this coronoid process? We are going to see it when we take a maxillary radiograph. Okay. So this is very important. Please get this into your head. Coronoid process is a part of the mandible, but it will be seen where? In the maxillary IOPS. It is frequently apparent on the periapical film of maxillary molar region. Okay. Now it is a triangular radiopacity with the apex directed superiorly and anteriorly. Okay. So you see it over here. See, look at this border. Can you see this border? Okay, you will see for locating this, first look at your third molar. Okay, after that you have your pterygoid, your maxillary tuberosity, and you will have your pterygoid plates also over here, and overlapping that you will have your coronoid process. Done? Okay, so we are done with our mandibular with our mandibular landmarks. Let us just quickly go through them. First for the symphysis, where was it? It was in the between the two uh, parts of the mandible, and it becomes less apparent after 1 year of age when it fuses. Then the genial tubercles. Where is the genial tubercles? There is the foramen genial. The foramen is there, right? So the foramen, that is the lingual foramen. The genial tubercles will overlap it and surround it like a ring. Okay. Then the next is the mental ridge. The mental ridge, where is this? These are two oblique lines which are seen internally, and they will apex towards the incisors and run backward towards the molars, premolars, right? Then the mental fossa. Mental fossa is between your alveolar ridge and your mental ridge. Okay, so the depression over there. Then the mental foramen, where is it? Between your second, below your second premolar, or between the first and your second premolars. Then the mandibular canal, again it's a radiolucency that is running below the apices of all the teeth, and it has a opaque border, that is the cortication. And yes, okay. Then the nutrient canals, okay, they are vertical lines that run from the inferior alveolar canal upwards to the apices of the teeth, and they can also be interdentally. Okay. Then you have the mylohyoid ridge. Where is this? This is inside internal oblique ridge or mylohyoid ridge. Please don't confuse between these two, because sometimes they can ask you what is mylohyoid ridge, and sometimes they can ask you what is internal oblique ridge. So you should know that these two things are the same. Okay. Again, this is this line that is the oblique line that is running below your molars. Okay, and it runs downwards from the third molar to the premolars. Okay. Then, okay, now that we've talked about all of them, let's just look at over here. Okay, in this one particular radiograph, what all landmarks can you see? See, you can see nutrient canals, right? Then you can see this is your mylohyoid ridge, the oblique line. And look at this, you can see a mandibular canal over here. Can you see? And it is surrounded by corticated boundary, that is your radio opacity. Okay, what else can you see here? Okay, this portion above this below from a alveolar ridge, this okay, and this is the submandibular gland fossa, right? Whenever we're talking about your third molar region, you will always have your submandibular gland fossa, which is here. Okay, then external oblique ridge, this is the anterior continuation of your ramus, and you will see it as an extra opacity, like an extra whiteness over here in the area of the behind your third molars, right? Inferior of the border of the mandible, we all know it is going to be over here. Okay, and how do you know that it is inferior border? Because after that there will be full darkness or blackness. Right? And the coronoid process, this being a part of the mandible, but then it is seen only in your maxillary third molar radiographs, and which is like this. And along with that, in that same region, you will see a maxillary tuberosity, and you will see the pterygoid plates and your hamular notch. Okay. So with that, we have finished our radiographic anatomy for the maxilla and the mandible. Okay. We will proceed in the next class.